Hi, my name is Julia Hankenhof, and today I'll be talking about behavior theories and models. It has been proven that changes in behavior can improve all aspects of life: physical health, mental health, and relationships. In young students, 60 minutes of physical activity improved test scores, grades, increased self-confidence, reduced anxiety, boosted memory, and improved behavior in children with behavioral issues. Health behaviors, sometimes called health-related behaviors, are actions taken by individuals that affect health or morality. Behavior models have been used to change people's views on exercise, and after going through trials, people have found that they have a more healthier and positive outlook on life when behavior is changed. Today we will discuss the different health behaviors, models, and theories. There are multiple health behavior models that psychologists use to help change a person's physical activity and behavior toward a more positive lifestyle. The behavior models are the following: the trans-theoretical model, social cognitive theory, theory of planned behavior, and the health behavior model. The trans-theoretical model involves the movement of people through 6 stages: pre-contemplation, contemplation, preparation, action, maintenance, and termination. Pre-contemplation is the stage of TTM where people are not prepping to take action. They are unaware of the unhealthy behaviors in their life and do not think they need to change anything. Contemplation is the stage where the person begins to realize they have a problem. They start weighing the pros and cons in change, and if the change in life would even be worth it. Preparation is the stage where the person has thought about it and has the intention to make changes and makes goals. They take small steps towards a goal that they want to achieve. Action is the stage where the person takes large, overt steps to modify the behavior. Termination is the stage where individuals realize that they do not want to go back to their old habits. They like the new habits that they have created and do not want to go back to the previous days. These type of stages last at least 6 months. Every person differs in the time they take to change a behavior. Some take 1 year, and some take years to accomplish their goals and get to the last stage of termination. This specific behavior model relies on the person going through the change to have confidence, focus, and being able to execute the behaviors needed for change. There was a study done on rice farmers. The study was conducted to test the effects of TTM on rice farmers with chronic low back pain to improve back muscle endurance. The purpose of the rice farmer study was steered toward finding the effects of an intervention program based on the trans-theoretical model on back muscle endurance to help the chronic low back pain. Most of the participants in both the control group and the TTM group were in pre-contemplation stations, where they did not realize they needed to increase their muscle endurance to get rid of their low back pain. At the end of the study, 51.6% of members in the TTM group were able to accomplish to the termination stage of the process, whereas only 20.3% of the control group were able to get to the termination stage. The findings of the study revealed that the intervention program for TTM could provide a positive change in physical activity and function of the lower back. After the farmers went through the program, majority of the participants were able to continue their muscle endurance exercises because of their change in behavior towards low back pain. Another study was done to compare the health belief model and the TTM among African American college women with physical activity. African American women have a higher risk for chronic diseases such as hypertension and type 2 diabetes. These types of chronic diseases can be prevented by activity levels. The purpose of this study was to use concepts of both the health belief model, discussed later, and the TTM to identify how perceptions of physical activity differ among the stages of physical activity behavior change. Many participants were in the pre-contemplation stage of TTM because they did not realize that they had such a high risk of chronic diseases that could be prevented. Unfortunately, the study concluded that the theory-based perceptions related to physical activity varied according to each participant. Some participants knew the risk and didn't want to change any behaviors in life. Some wanted to change but did not continue the change after a year past the study. Some continued to change for years to come. For the TTM, there are positives and negatives of the change, but it is the most popular belief model that is used in today's psychological world. The social cognitive theory focuses more on behavioral learning theories. It adds a meditational and observational learning process to the behaviorist learning theory. The social cognitive theory has classical conditioning, operant conditioning, meditational processes, which has attention, retention, reproduction, and motivation, and observational learning. Classical conditioning associates an involuntary response with a stimulus. It combines the pairing of a previous neutral stimulus with an unconditioned stimulus. An example would be the sound of a bell associated with the taste of food. Operant conditioning is a learning theory that involves behaviors strengthened by reinforcement or diminished by punishment. It basically involves applying reinforcement or punishment after a behavior happens. There are 4 responses that are under the meditational process. Attention is when a person notices the behavior, but the behavior has to be worthy of attention for it to be imitated. Attention can be important in the fact that a behavior has an influence on imitating others. Retention involves the memory of a behavior. The behavior might be observed, but maybe not necessarily remembered by the person. So if a behavior is remembered, it is important so that it may be performed later. Reproduction is the ability to perform the behavior that was observed and remembered. There are limits to reproducing a behavior, which is usually physical. Motivation is the will to perform the behavior. Usually a person that performs this knows the punishment or reward that follows the behavior and knows what they are getting into. You can think of these different meditational processes as a child growing up learning things from models in society such as parents, teachers, and even friends around the community. Observational learning is when a person observes a model such as a parent, TV, friends, and teachers. These models in society are then observed by others to imitate the behaviors performed by the models. There was a study completed in Canada on testing the SCT and physical activity on helping patients with type 1 and type 2 diabetes. This study was created to test the SCT in explaining physical activity in a large population of type 1 diabetes and type 2 diabetes. The results provide support for the application of SCT for promoting physical activity in persons with diabetes. The study found that the more time spent in physical activity, the more social support and self-efficiency a person had. So not only did physical activity help the person with their self-confidence, but it also helped their social skills become better than they were before. The theory of planned behavior explains a person's behavioral intentions and behaviors in terms of attitudes, subjective norms, and perceived behavior control. In this specific theory, there are multiple beliefs that lead to intentions that then lead to behavior. One of the beliefs is a behavioral belief. Behavioral beliefs produce an attitude toward the behavior and guide considerations of positive and negative outcomes. Another belief is a normative belief. It results in perceived social pressure or the subjective norm. It's basically the social pressure to act in a situation. Control beliefs produce a behavioral control by impacting performance on the behavior. This person decides on if they will perform the behavior and if they have the knowledge to make the appropriate decision on the behavior. Intention indicates the readiness to perform the behavior. It's based on the attitude, subjective norms, and perceived behavioral control. Actual behavior control is the extent to which a person possesses the skills, resources, and other prerequisites necessary for the behavior. Behavior is the observable response in a given situation toward a target attitude. With the TPB, it is believed that behavior, especially in humans, can be driven by social and contextual issues. Social issues are associated with family environment, school, work, and peer pressure. Contextual issues can be psychosocial factors such as stress, depression, and hostility. There was a study conducted by Texas A&M and Iowa State University on studying TPB and intentions to attend a sport event through a more social context. This study was conducted to see if behavior changes and social issues can change college students' aspects on attending a hockey game. The study found that social issues such as friends had a huge influence on the decision to attend any sporting event. They also found that the sociability of the sport event is important to attracting people to these events. This includes events like tailgating, social events with the team players after a game, and even booster clubs. Behavior changes can be with not only with the fans, but the athletic department and players also. This is a diagram that explains more of how the theory of planned behavior all relates to each other. The health belief model talks about how medical treatments and behaviors associated with certain diseases. There are multiple barriers that factor into the health behavior model, such as demographic, psychosocial, seriousness, susceptibility, perceived benefits, perceived barriers, threat, self-efficacy, and cues to action. Perceived susceptibility refers to a person's personal perception of the risk of acquiring an illness or disease. Perceived severity refers to a person's feelings on the seriousness of contracting an illness or a disease. Perceived benefits refers to a person's perception of the effectiveness of various actions available to reduce the threat of an illness or a disease. Perceived barriers refers to a person's feelings on the obstacles to performing a recommended health action. This person weighs the effectiveness of the actions against the perceptions that it may be expensive, dangerous, unpleasant, time-consuming, etc. Cue to action is the stimulus needed to trigger the decision-making process to accept a recommended health action by a professional. These types of cues can be external or internal. Internal could be where a person's trying to figure out if to see if the treatment would even be worth getting into. External cues would be a doctor or a nurse coming in to tell the patient different options that they have. Self-efficacy refers to the level of a person's confidence in their ability to successfully perform a behavior. A study was conducted on the comparison of the TTM and the HBM on ending smoking with nurses. The HBM had a bigger impact on ending smoking quicker, but the lasting effects were not as positive as the TTM. Both groups, the HBM and TTM, had nurses who had been smoking for more than 20 years, where the average onset of smoking was generally the age of 16. After both groups went through trials of the different behavior models, it was found that there was an increase in the negative attitudes of smoking. For the TTM group, the nurses took longer to change their negative behavior of smoking, but they had quit smoking longer than the participants in the HBM group. In the HBM group, the participants reached the goal quicker, but they returned to their negative behavior quicker than the TTM participants. This study showed that it's possible to change negative behavior with more than one model to a more positive behavior in any type of group of people. This is a diagram explaining how the HBM all relates towards each other. A study done by Bakke and Branscombe states that it found that the majority of alcohol drinking in undergraduate students can be both internal, habitual, and encouraged by peers around them. It has been proven time and time again that changes in the way people look at situations or change their behavior toward an object can improve overall health, physical and mental. This specific study of alcohol drinking showed that peer pressure and social factors affected alcohol drinking in undergraduate students more than any other factor. Overall, this study provided evidence for the usefulness of using the TPB and the HBM for understanding and even predicting behaviors that could possibly occur. Psychologists can then use these different behavior models to figure out what a certain person's behavior may be in the future according to demographics, social community, family, and even race. Each model has its pros and cons, but each one can be beneficial if applied to different aspects of life. Thank you for listening and taking time to learn about behavior theories and models today. Hopefully you learned something and can take this to your area and apply it to situations and people around you.